Hello and welcome to PROMs. That's patient-reported outcome measures. Before we start, this video will be most useful if you already know the basics about PROMs and are familiar with our publications and how we make data available. Hopefully you've watched our previous videos, giving you an insight into what PROMs is, what we publish, and you've had a look at our publications and viewed the data on NHS Choices. In this video, I'm going to show you the CSV Datapack, which is a collection of machine-readable files that allow users of PROMs data to analyse the data themselves. We follow the government's open data policy, which means we publish data through a variety of means, and the CSV data is designed to encourage and enable the reuse of data. We publish two kinds of data within the CSV Datapack. Firstly, data which has been aggregated and suppressed where necessary to ensure that people aren't identified from what we publish. Second is record level data, with identifiers and almost all demographic characteristics removed. Again, this ensures that people can't be recognised from what we publish. As a further safeguard, we only publish record level data if a minimum number of patients share exactly the same characteristics, another safeguard against re-identification. So, let's start. The key facts. Key facts shows how many patients improved, stayed the same, worsened following their procedure. The file is broken down by organisation, provider and the Clinical Commissioning Group or CCG to which the hospital belongs, as well as procedure and PROMs measure. This file does not provide any information about the size of the health gains made by patients, just the proportions of patients that reported improvement or other outcomes. All paired questionnaires where patients answered enough questions to calculate health gain are included in this file. They do not need to be linked to a hospital stay. The participation linkage file shows the following information for each procedure as well as for all procedures. Total HES procedures is the number of hospital procedures carried out within the trust. Total pre-op queues is a count of all the preoperative questionnaires given to patients before the procedure that have been completed and sent to the HSCIC. The participation rate is the number of preoperative questionnaires returned within the reporting period as a percentage of the number of procedures carried out in the same time period. Participation rates may therefore be higher than 100%. This is caused by patients undergoing surgery at a different provider to the one which administered the preoperative questionnaire. This may be because of patient choice or subcontracting arrangements. Total linked is the number of questionnaires that we have been able to link to a hospital procedure. The linkage rate is the number of linked preoperative questionnaires as a percentage of the total number of preoperative questionnaires, not episodes. Total Q2s sent to date is a count of the number of post-operative questionnaires that have been sent out. The issue rate is the number of post-operative questionnaires sent out as a percentage of the number of preoperative questionnaires. There are a number of different reasons why not all patients are sent a post-operative questionnaire, such as the procedure being cancelled. Total Q2s returned to date is the number of post-operative questionnaires that have been completed and sent to the HSCIC. Finally, the response rate is the number of returned post-operative questionnaires as a percentage of the total sent out. The Provider Commissioner file is similar to the Key Facts file, in that it shows the number of patients who have improved, stayed the same, or worsened by procedure, measure, and organisation. However, this file shows these figures for modelled records only. A modelled record is a pair of pre- and post-operative questionnaires which contain a valid score for a given measure and can also be linked to a hospital record. Using modelled records, we are able to calculate the average health gains that take into account the differences between hospital trusts in the kind of patients they treat, allowing for fair comparisons. This file shows, for each procedure, measure and organisation, counts of modelled records, unadjusted pre- and post-operative scores, and adjusted average health gains. It also gives the average post-operative score and adjusted average health gain, as well as the standard deviation of the adjusted average health gain, which summarises the variance in the scores that make up the average, with a lower number indicating that the distribution of scores is clustered around the average, and a higher number indicating the scores are more spread out. No adjusted results have been calculated for those organisations with fewer than 30 modelled records, as the underlying statistical methods break down when counts are low, and aggregate calculations based on small denominators may return unrepresentative results. We also have record-level data files, which cover all 4 procedures. These files include one row for each patient questionnaire successfully linked to a hospital record, and show the individual responses to the questionnaires. We take patient confidentiality seriously, so records have been excluded where there otherwise have been fewer than 6 records present for any provider. Where there are between 1 and 5 records for a particular combination of age band, sex, provider and procedure, the age band and sex have been suppressed and replaced with an asterisk. Where it would have remained possible to identify suppressed cells by derivation from the total, additional cells have also been suppressed. The column headings are explained in the PROMs Data Dictionary, which is available from the main PROMs page on the HSCIC website. Now, if you've seen our Google Maps tool, you'll have seen that the data for each trust displays a time series showing how the trust scores compare to the England average over time. The CSV Datapack also contains time series data, split by procedure, measure and organisation, and shows the number of modelled records, the adjusted health gain score, and whether or not the organisation was a statistical outlier for the last few years. We also provide a demographics CSV file with the annual publication, which comes out in August. This file shows summary statistics for each procedure and measure, split by the patient's age, gender, ethnicity and index of multiple deprivation decile, with 1 being the least deprived 10% and 10 being the most deprived 10%. Mean is the average score, the sum of all scores divided by the number of scores. 5% is the 5th percentile of the score or health gain. If all questionnaires were ranked highest to lowest by their score or health gain, 5% of all questionnaires would be equal to or less than this value. The first quartile is the 25th percentile, so that 25% of all questionnaires have scores that are less than or equal to this score. The median is the middle score, or 50th percentile. If there is an even number of scores, the median is the sum of the 2 values either side of the middle point divided by 2. The third quartile is the 75th percentile. This means that 75% of scores are below this value. 95% is 95% of scores below this value. There are also counts of patients who stayed the same or worsened. Finally, there is a PDF file that contains footnotes to help and understand and interpret the data in the CSV Datapack. I hope this has been useful, and if you have any queries about anything you've seen in this video, please contact us on enquiries@hscic.gov.uk or call us on 0300 303 5678. Thanks for watching.